99203 will be the lowest level of service that you should use for your new patients, and I'll show you why. And this is the second most common mistake by younger doctors because they're afraid to overcode. If you have all of that documentation there, you will not overcode at all. Now, 03, so this is something that of a little bit more importance. This is 1.42 work RVUs, and it pays much better than the level 1. Remember, level 1, how much was level 1? 44, from 44 to over 100. You're more than doubling your reimbursement by doing anything and everything you're doing anyway. And you'll see why, because very rarely will you do only limited service, as we just talked about. Again, documentation, you need 3 out of the 3, or if you're coding on time, it's 30 minutes. Now, this does get a little bit more complex. How so? Well, HPI, you now need 4 components. You can't just say ear hurts. Ear hurts, head hurts, abdomen hurts, everything hurts. All your patients have something hurting. I mean, they all have problems. They're all going to tell you this, so this is very easy to qualify for. Review of systems, 2 to 9. Remember I said the last time it was revised was in 1995. We did due diligence. We reached out to Medicare and we said, listen, is it 2 or is it 9? How many do you want? And the answer we got was 2 to 9. Well, if we only do 2 review systems, I was still eligible to code 9 and 2 or 3, and Medicare said 2 to 9. So I don't know what that means. My suggestion is that just use 9 review systems here and you'll be fine. It's very easy to review 9 review systems. Your medical assistant probably does it anyway by the time you even get in the room. So it's very easy. Still, and it kind of doesn't make any sense, you only need 1. You only need 1 past history here, only 1 social history, right? So all you have to do is ask him about, do you have any past medical problems, and you're done. We all go above and beyond this anyway, but these are the requirements. The exam becomes detailed. Now we need 11 bullets plus vitals, but remember how many we started with? 6. So all we need to do is just listen to the lungs, look in the ears, abdomen, and we're done. The medical decision making is no longer straightforward. It's low complexity. You need 1 diagnosis, which we'll have, and you need only 1 point from data. Remember, just order a lab, or look at all labs, or review all records. That gives you points. And low complexity risk. What's low risk? Any one of the following. Remember I said over-the-counter drugs? Yeah, so that's already low risk. So that's why if somebody taking over-the-counter drug, it's automatically at least level 3. If you recommend any of the following, 2 or more small problems, chronic illness, sore throat, it's low risk. If you order physical therapy, occupational therapy, if you freeze AKs in your office with liquid nitrogen, that is low risk to begin with. And here's the same patient. She's a little older now, and for an earache. And this is at least starting to look like your patients that you do see actually, and something that you actually do to your patients as far as the workup is concerned, as far as the wording is concerned. So yeah, you talk about what she has. We review past medications. You look at past history. You do review systems. This is probably done automatically by your staff, where it's very easy for you to ask the patient this. It doesn't take much time. An exam is a little bit more involved, and we just comment on the condition of your ears. It's the same otitis media. It's the same amoxicillin. For some reason, I asked her to take Tylenol, not Motrin, and we're gonna avoid Sudafed because she's on antihypertensive regimen. So the bottom line here is that this is probably what you always do to your patients. So at least start off here. You will have more than enough documentations. It's very easy to qualify.